Community Health Center of Lubbock opened in 1992, offering primary and preventative health care services at 8 locations in Lubbock.
CHCL was started by Sister Mary Kathleen Small to help underserved areas and help the medically indigent people here in Lubbock.
CHCL is dedicated in making sure we provide access to all the patients and all the patients here in Lubbock. So more than 60% of the patients that we see are unfunded and underfunded. So we do have programs that would make us possible to see patients. We have 2 optometrist providers that rotate in our site, seeing patients for diabetes with high blood pressures, making sure that the pressure inside the eyes are okay. If there's any changes behind the eye, they also do refraction, making sure that they have prescription for eyeglasses.
Our team of dental professionals offers exams, x-rays, cleanings, fillings, and extractions, just all the services needed to prevent, diagnose, and to treat dental problems. The health of your mouth can impact the health of the rest of your body. So sometimes dentists are able to diagnose that there may be another systemic issue going on, such as diabetes, just by the signs that we can see on your x-rays and looking at your teeth. So in that case, we can refer you to other healthcare professionals based on your unique needs.
We do mostly well child checks from newborn to 18 years old. We also make sure all of our children are caught up on their immunizations and given immunizations. We do a lot of school physicals, which we're going into the schools and doing them. This past month we've been doing them, and then into May we're doing school physicals for Lubbock ISD.
A major part of the mission of the Community Health Center is not only in treating patients, but in providing preventative care, doing that through education, use of the fitness center, and classes.
And the primary reason we did that was to help improve health outcomes and lower risk associated with disease, such as heart disease, diabetes, and obesity. We are working to try to educate when they see the provider initially. If they see a need where somebody might benefit from those programs, the provider will refer them to the programs, and then we do an initial assessment and we try to engage them into the process.
It's one of my favorite parts of my jobs is educating the families especially I do a lot more education in the newborn to 2-year-old phase. We still, of course, do education with every visit, but with new moms, there's lots and lots of questions, so it's fun to be able to talk to them.
Simple things: hand washing, covering your mouth and your nose when coughing or sneezing. This has been taught to us since kids, but in the last 2 years, this has been very important in preventing and mitigating spread.
Community Health Center originally was located on Broadway. They moved into this beautiful building in 2015. Part of its charm is an indoor waterfall.
In this new building that we were able to build, we were able to put a water feature in it, and it's not running right now. It's behind me here. It will be turned back on probably in the next few months.
Well, I'm most proud that we're able to really make a difference in people's lives.
Our patients, have commented in the past that they have a new life because they've come to CHCL, and I know that's attributable to the passion of our staff.